Hello everyone, my name is Yasmin Barakat, and this is my research proposal on breastfeeding education and impact on initiation rates. When it comes to breastfeeding, the risks of not breastfeeding outweigh the benefits of breastfeeding. Breastfeeding is beneficial to both the mother and the infant. Breastfeeding has also been shown to reduce healthcare costs, strengthen immune systems, and it is protective against chronic non-communicable diseases such as heart disease and diabetes. According to the World Health Organization, it can also prevent the prevalence of increased weight during infancy, which is positively associated with the development of obesity later in life. National campaigns are aiming at increasing breastfeeding support to prevent obesity since rates in breastfed infants are significantly lower. The American Academy of Pediatrics stated that breastfeeding is a public health concern and one should not see it as a lifestyle choice. Breastfed infants who are formula-fed at the hospital are 144% more likely to stop breastfeeding by 3 months, indicating no initiation occurred. Healthy People 2020 has set a goal to increase breastfeeding initiation rates to 89.9% across the U.S. And while rates continue to increase every year, racial disparities do persist. WIC, which is a nutrition program that provides education on breastfeeding throughout pregnancy, compiles data at the end of each year. In 2016, WIC data showed that the lowest breastfeeding initiation rates were in the Hmong population. Out of over 2,000 individuals, only 63% initiated breastfeeding. This quote on the side here was taken from the Minnesota Health Department, and it discusses what and how much could be prevented if 90% of women who gave birth in Minnesota breastfed optimally. This includes 38% of child deaths, over 7,000 ear infections, and a cost saving of over $200 million. Globally, breastfeeding rates are low, and the Americas have the lowest breastfeeding initiation rates. This shows that there is a need to increase breastfeeding initiation rates as more studies with effective interventions can be used worldwide. According to the CDC, mothers don't breastfeed often due to their lack of knowledge about breastfeeding. An analysis of 5 studies concluded that in low-income women, breastfeeding education resulted in significant increase of breastfeeding initiation rates. Another study of over 400 women concluded that mothers with enough breastfeeding knowledge breastfed longer than mothers with less knowledge. The reasons they didn't successfully initiate breastfeeding was due to their idea of insufficient milk supply and lack of confidence in their ability to feed their hungry infants. A study in Detroit showed that initiation rates are high when a prenatal intervention is introduced. Another study used modules as part of their intervention 3 times at the 3rd trimester. The results showed that 95% initiated breastfeeding, and over half stated that the modules affirmed their decision to breastfeed. In another cohort study, about 85% of women initiated breastfeeding when they were exposed to breastfeeding education prenatally. So this shows that more knowledge results in women being 11 times more likely to initiate breastfeeding. Racial disparities are not accounted for in the literature. Studies only focus on education at the end of pregnancy, and a study discussed Hmong breastfeeding beliefs. This shows that they think formula is better, and they also think that Americans don't breastfeed, so it's not really the norm. Predictors to stop breastfeeding before 3 months have been confirmed by multiple studies that I previously discussed, and those include formula use at the hospital, milk supply concerns, and latching difficulties. My research question looks at if providing breastfeeding education through a video once per prenatal visit at each trimester will have an impact on breastfeeding initiation rates. My null study will show that breastfeeding education will have no impact on breastfeeding initiation rates, while my alternative will show that there will be an impact. This will be a quantitative and prospective study. Descriptive analysis will be used to measure variability of data, and 70 subjects will be asked if they are interested in being part of a study about pregnancy, health, and nutrition. The target population are first-time Hmong American pregnant women who are low income between the ages 18 and 36. The intervention group will will include breastfeeding education video that will be viewed, and the control group will be in a nutrition education video. We will compare both groups and look at the significance between breastfeeding initiation rates. The researcher will partner with a large healthcare provider in the Twin Cities of Minnesota, and subjects are recruited based on race, ethnicity, and socioeconomic status. To continue being part of the study, they must continue through 38 weeks gestation or more. We will use a chi-square test of independence to assess both groups. A 2x2 contingency table will be used, and we would want the p-value to be less than 0.05 so we can reject the null hypothesis. The breastfeeding educational videos are using predictors of breastfeeding cessation as noted previously. Some topics overlap and some are repeated to make moms more confident and more knowledgeable about the topic. These videos will be completed by a local IBCLC who is trained on counseling specifically in breastfeeding and nutrition knowledge. The control group will receive 3 various videos about nutrition topics. The subjects in the study are considered a highly vulnerable population, so an IRB approval will be needed. Informed consent will be needed, and so to minimize risk, participants are contacted indirectly through their doctor instead of the researcher. Patient information will remain private and be identified to the researcher by code numbers. And in terms of environment, we will ensure the same classroom is used and will be large enough to fit 5 individuals. We expect that 95% of women in the intervention group will initiate breastfeeding successfully, and we will reject the null and have a p-value of less than 0.05. The limitations of the study include a small sample size, it is a specific population, and we are unaware of their previous breastfeeding knowledge. My study is important as it will help in expanding healthcare collaborations and make lactation professionals part of the prenatal visits to discuss breastfeeding education. This will show the significance of integrating prenatal breastfeeding education early on in the pregnancy and to continue throughout. Thank you so much for listening to my presentation, and here's a list of my references. Thank you.